It's been a privilege to work with the health team here and the governor. We talked about your opening plan, I think, late Friday night. I think you worked 24/7 too. Late Friday night, sometime the end of April, where we talked through each of the aspects of the opening plan. And it was a very serious and safe opening plan, and you can see the impact of the opening plan and how it worked out all of May for almost 5 weeks. And then there was an inflection point, and I really appreciate the governor and the health committees really understanding that that inflection point was around test positive. That seems to be our earliest indicator of new cases, because we have enough testing now at the community level to start finding the asymptomatic and early cases, and we can start seeing even the increase in test positive before we see evidence of increased hospitalizations. And I think that is good to know that that's an alert system that we can trust, and it's an alert system that we can trust as you begin to control this. And we've been having a great meeting with the health commissioner and your health leadership at this medical center. And I think the concern that's been raised is what is happening now is very different than what was happening through April and May, where you were having outbreaks that were quickly contained because they were in a nursing home or a prison or a meatpacking plant. And somehow over the last 15 or 16 days, it's taken on a very different aspect through Texas. And you can see it in Harris County. You can see it in Harris County primarily. You can see the rate of increase is quite enormous right now. And you can see it in Bexar County and Travis County. Dallas is more steady in its rate of increase. But I think in talking to your medical group here and to all the Texans, what we are seeing here is a increased rate of hospitalization of 20 to 40-year-olds. And I think that really tells us that there is a lot of infection in the 20 to 40-year-olds. We know that's the primary asymptomatic group. But what it tells us in that asymptomatic spread, it's hitting those vulnerable 20 to 40-year-olds that have issues with comorbidities, maybe a little obesity, a little type 2 diabetes. And so when you're out with your friends, and I want to thank the governor for his action on the bars and really appealing to every Texan to wear masks. I think we know now there's scientific evidence that masks both keep you from infecting others, but may also partially protect you from getting infected. I think that's a new discovery and a new finding. And it's very encouraging to Texans to know that you can protect one another. I know it's difficult in the 30 and the 20s and 30-something, but really just here really to ask every one of them to wear masks, every single one of them to wear a mask. And if they're interacting with their parents and grandparents, they should wear a mask then too. Because we know now how many of them are asymptomatic, and no one wants to pass the virus to others. But we see from this very medical center that you have 20 to 40-year-olds in the ICU. Now, most likely they will recover because Texas has done extraordinarily well. But we have to protect one another. And so I really came here with the vice president to really hear what was happening at the ground level, to get a report. Because in the end, it's communities that will stop this epidemic with great state leadership. And we are grateful to be here and to learn from you all and to take that back and take these best practices. Take the best practices of closing the bars and then following the impact. By getting masks, 100% compliance in Harris County and Dallas County and Bexar County and Travis County, and really get and see that impact. We have additional tools that we didn't have just 2 months ago. We have different tools to prevent the spread with masks and social distancing at a much higher and greater level. We know now with closing the bars. But we also have better therapeutics and better care and better knowledge about how to save people's lives. So we have a different tool set to bring to the people of Texas to actually curb the epidemic and stop the spread here, as well as ensure that everyone in the hospital does well. So thank you for the opportunity to meet for your staff. Thank you for all your staff coming in on a Sunday, spending the time with me. I am deeply grateful.